in this case, if I'm doing the cervical spine, I don't want to be on the side, I want to be behind my patient, so you're going to be facing the other way. That'll be a good starting point, right? Patient position, then doctor's position, right? Then we start at one point and work our way down. So what's the first area that we basically in the motion palpate in the spine? Right. It's his head attaching to his spine, right? So that's the first segment that you guys want to motion palpate, right? Then motion palpation is usually preceded by what? The ranges of motion, right? So that should give you a clue as to how you're going to do your motion palpation, right? So what's the different ranges of motion for each, basically each part that you're going to motion palpate, whether it's the cervical spine, thoracic, lumbar, or your extremities, right? So that you don't get confused, just look at the range of motion, right? So in the cervical spine, flexion, extension, right? Lateral flexion and rotation, right? So that's the basics. That's why I said start with observation, next step, range of motion, right? The motion palpation is usually the last thing that you want to do. Okay? So if you know your range of motion, you won't get confused with your motion palpation. Right? What motion palpation really is, what you're trying to see, right, is whether that joint has, number one, its normal full range of motion, which basically is what you test when you're testing range of motion, right? So ideally you will have some tool to measure, like over here we can use the goniometer, and then you know what the normal range of motion is, right? And then if there's less movement, you're not sure where the problem is, right? Is it a muscle problem or is it actual restriction in the joint? That's why you're going to basically do your motion palpation, right? Okay. But even in normal joints, if you use the shoulder as an example, right? His shoulders should have a normal range of motion, right? And then when you get to the end of that normal range of motion, you should have an additional range of motion, right? So your shoulder here, this is the normal end range of motion. I should be able to push your shoulder back a little further, right? So that's called the end field or end range of motion. And every joint should have that. Obviously, if I lift his shoulder up, it's very easy to see that additional movement. Because how big is his shoulder joint? Alright? Okay. Now compare his shoulder to his little joints inside his neck. So that's why the practice part is so important. That's why you guys have to keep practicing and practicing and practicing, so that it becomes as easy to feel the joints in his neck as it is to basically feel the movement in his shoulder. Alright? And you can only get that by practicing. You can't really do it by practicing once and saying, oh, I got it. Right? So you got 4 years to keep practicing that movement over and over and over and over again. Right? I won't call it a challenge or a difficulty, but remember, most of you are perfectly normal. So what you're going to be examining is normal movements in all the joints. Right? The good thing about that is one day when you get into practice and somebody is abnormal, it will be very easy to identify the abnormal. Right? So like most things in the medical field, you need to know what's normal before you can know what's abnormal. Okay? So don't waste your time by doing other things besides practicing, right? Okay. So coming back to his motion palpation. Okay, right? So what we want to see is we want to take that joint to its normal range of motion, and when we get to the end of that range of motion, from your side, the person doing the motion palpation, right? Okay, you're going to, so if I get to the end of this movement, I'm physically going to push the shoulder, right? And see how far it can still go, right? So motion palpation is 2 steps. Moving the joint through its range of motion, and then applying a little additional force, and then feeling whether there's additional movement, right? So it's just those 2 steps. So if I'm looking at extension, right, for his head in relation to the top of his spine, right, okay, I'm basically going to be extending his head back. So that's the normal range of motion, right? So you guys can see over there. I need maybe a little bit difficult. So that's step number 1. Step number 2 is trying to see if there's any additional movement in his spine, right? Okay, so in his case, it's normal. So every different part that you're basically motion palpating, same like later when you're doing adjustment, right? Okay, the area that you contact is important, right? I'm assessing, right, the top of his spine, I cannot be contacting down here, right? Because then I'll be looking at a different joint. I'm just combining everything I know we started here, right? Similarly, if we talk about the thoracic spine, right, or the lumbar spine, right, okay, if we're looking at movement, the movement has to be isolated around the segment that you motion palpating, right? Okay? So if I'm looking at his L2, right, I'm not going to bend his whole spine without actually making sure that it's flexing around the L2 area. Right? Okay? So in real patients as well, what happens if he has a problem at the L2 area, his body will compensate, and generally the areas either above or below will be hypermobile, and there'll be more movement around that areas. Okay, so moving on in future, right? Next semester, that kind of thing. That's the thing that you guys should be learning and looking out for, right? This is just looking at the normal, and later on is trying to figure out what the variations are away from the normal. Okay, right? So just remember to isolate the segment as well. Okay? So when we're looking at his movement for his head in relation to his spine, it's extension. Let's see if it goes back. So in this case, we can just have a look at his nose, right? Okay, so we also need to feel and see at the same time. So this is slightly different to your observation, right? Okay. This is, or rather, this is exactly your feeling, but you're using your eyes as well. You're using your eyes to basically reinforce your feeling, all right? Okay. When we're looking at going into extension, right? I'm still keeping my eyes on his nose. I'm just extending his head and then seeing if there's any additional movement. Okay. Certain joints, or rather every joint for that matter, right? You have to look at the anatomy of the joint as well. Right? So in this case, what's the anatomy of the joint? Basically, it's the shape of the joint. Right? Okay. This is important when you guys are moving on to learning adjustments later on as well, right? Because you need to make sure that you know the anatomy of the joint so you can basically adjust in the right direction. So that's kind of called your line of drive, right? So if your line of drive is not going in the right direction, number one, the adjustment's not going to work, but more importantly, you stand a risk of actually injuring your patient, right? So just like the ranges of motion, make sure you know your line of drive, kind of like you learned the periodic timetable. Get the idea, right? So you can't get that one wrong. Okay? So in this case, his joint here is basically kind of U-shaped, right? So if we're going into flexion extension, the movement should be, right, not a straight movement, but more like a boat that's rocking. Get the idea? So in your mind, you're visualizing that movement, and then you're feeling for it, and you're looking for it at the same time. Alright? Okay. So it's coming back, feeling that rocking movement, going a little further, going forward, feeling the rocking, and going a little bit further. Simple, right? Not too complicated. Similarly, when we're going into lateral flexion, going off to the side. So this is where it's important that you're only laterally flexing at that segment. So I can either bend him here and feel for extra movement, or I can bend his whole neck. So you guys see the difference between doing this and doing that? Okay. So you need to isolate that segment and make sure you're working on that exact segment, right? So especially in the cervical spine, similarly in the thoracic spine, right? When we are actually motion palpating T1, right? Okay, which part are we going to be moving? It is kind of like trick questions. Hopefully you guys don't get this trick question in your exam, right? Okay, so in the thoracic spine, T1, we're going to be using his head, right, as the part that's moving. Compared to, let's say, for example, doing the same thing at T7, we're not going to be using his head, right? Because there's no movement from his head moving to T7. We're doing T7, we are going to be basically bending him over T7, right? Okay, at that level. So similarly here in the neck, right? If you're laterally flexing, it's only here, not the whole neck going off to the side, right? Rotation is the same. It's just rotating here, looking at you guys, and see if you can look over your shoulder. But remember, when you're doing this, you would have done your range of motion already. So in your mind, you're knowing where to expect important thing, what we did in this class as well, is identify certain landmarks. Okay, remember that? The important landmarks, for example, in the spine would be your C2, because that's the one you're going to start your palpation from. Okay, right? So for flexion and extension, right, where's our contact? Anybody remember? Are we contacting on the spinous process, right? Okay, or are we contacting anywhere else? Okay, so if you guys want to kind of, what's the word I'm looking for? Learn how to learn this, right? Okay, you can do it like in a table form as well, right? So if you go cervical spine motion palpation, right? And the first thing that you're going to put down, right, is your patient's position and the doctor's position, right? Whether you're standing behind your patient, to the left or to the right, right? Because it's important, like we're doing the thoracic spine, right? Okay? You can't laterally flex your patient right hand side from the left hand side, right? You can't go here and then try to do the same thing. You physically have to step over to the other side. Okay? The second thing that you want to put down in your table is basically, right, where's your contact for each movement, right? So if it's flexion and extension, what's your contact point? If it's lateral flexion, what's your contact point? If it's rotation, what's your contact point? Get the idea, right? So that applies to cervical spine, thoracic, lumbar, and your extremities for that matter. Get the idea? Okay, right? So coming back to the cervical spine for flexion and extension, what is our contact? Posterior, inferior. Okay, so you basically contact it on spinous process, right? Okay, the last thing that you put in your table is what you're supposed to feel. Right? So when we're doing flexion and extension of the cervical spine, what are we feeling for? Anybody? What's supposed to happen to those spinous processes? Right? Don't worry, you don't have to be a chiropractor to figure this one out, right? Okay, just use your brain. So the spinous process is just going to separate, right? Okay, when you go into extension, what's going to happen to the spinous process? Did you guys ever wonder why you have all these models around here? I'm not talking about the ladies, the skeletons, right? Okay, so if you actually want to see what's happening, just pick up one of the skeletons and basically run them through the ranges of motion, right? That's a good way for you guys to remember what things or what happens, right? Okay. So next part, when we're looking at lateral flexion, where's our contact there? Okay, and what are we feeling for? Yeah, so my model here is answering the question as well, right? Okay, can you tell them? What is being pushed to the opposite side? Yeah. Okay. Remember, number one, right? You're the one that's actually doing the pushing, right? Okay. So one, you should feel normal movement. At the end of that normal movement, you're the one that's actually doing the pushing and feeling for additional movement, right? Okay. So it's just like the shoulder up here and some more, right? Okay. In terms of rotation, what are we feeling for? What should happen? What's your contact and what are you feeling for? What's the contact point for rotation? Right, even the cervical spine. You're still on the spine process? Sure. Okay, and what are you feeling for? The next model, right? So how are you going to contact the spinous process for rotation? So just think about this when you guys are doing it, right? It's rotating, right? How's it going to rotate? So the same thing's gonna apply, right? Cervical spine, thoracic spine, and lumbar spine, right? Okay? So not that complicated, right? Okay. Now, whether it comes to motion palpation, right, or whether it comes to your adjustments that you do later, all right, this is kind of like an inside secret, right? Okay. Person looking at you, right, doesn't always know where your contact is, right? Okay. But what you need to know is where the contact is, right? Okay. So if you're doing your test, make sure you use your words, right? Okay. See, like you telling them what to do. So when you do your test, right, make sure that you explain to your examiner what your contact point is, all right? Okay, so that they are clear that you know what you're doing, right? But the most important thing is have some confidence when you're doing it, all right? So don't go when you are asked to do motion palpation at T1, right? Okay, don't spend 2 minutes trying to find T1, right? Okay, and don't fumble around trying to say, oh, I have to move. What do I need to do? Is this lateral flexion, right? Okay. So it's both motion palpation, right? Okay. Just the first one, right? The part that we're moving his head, right? Okay, in relation to his spine, right? That's why our contact is basically his skull, right? So we're going through normal range of motion and then applying extra force, right? Okay. If we are going at between, let's say, C1 and C2, right? Okay, or C2 and C3. We're still going back, and now we're feeling what happens to the spinous process. When we reach the end of that normal range of motion, we can also apply additional force, right? Yes. Passive range of motion, right? That would just be taking his head and moving it until that. Flexion and extension, lateral flexion and rotation. So, better way to understand this is let's look at what happens when he has an actual problem, right? So let's say, for example, right, you asked him to go through active range of motion, right? Okay. What's the active range of motion? This is lateral rotation to the right, to the left, and to the right. Okay. Lateral flexion to the left, to the right, but I'm not really touching it. Right? He's just going through the motions. So let's say, as an example, in this case, right, his left hand side goes all the way normal, but his right hand side, he only moves this much. Right? So this is left is normal, right is only up to there. So what's the first thing that we observe during his active range of motion is that he has limited rotation to the right hand side. Okay. So what does that tell us is that either he's got tight muscle, for example, on the left hand side, which means he can't move his head to the right because that muscle can't stretch, right? Okay. Or alternatively, he has some problem in his joints on the right hand side, for example, right? But you don't know. Okay. So if you're going to do passive range of motion, what are you basically doing is you are taking away, right, the work of his muscles. You're basically doing the work for him, all right? So if I then passively move his head to the left, the movement should still be normal, all right? But if I passively move him to the right, and he still has limited movement here, right? Okay, then we know he definitely has a problem going to the right. Okay, right? Because we've basically taken over the work of the muscle, right? So sometimes what happens when you do passive range of motion, we actually get more movement than if he does it actively. Okay, right? Then the next step is basically to do the motion palpation, right? Okay, so motion palpation, you have two parts. Remember, one is static and one is the motion palpation. When we're doing the static palpation, what are we going to look for? We're going to look at his muscles, right? So which is the muscles responsible for rotation of the neck? Yeah, okay. So which SCM will be tight if he can't move his head to the right? Right, okay. So what are you going to palpate? He's going to palpate his SCM. right? Okay, see if there's any tension in that SCM muscle on the left hand side, right? Okay, if the SCM is tight, you know it's got a muscle problem, right? If its SCM is not tight, then you're gonna motion palpate the joint. Get the idea? All right. So then what we're gonna do is basically take his head here, right? Get to the end of that range of motion and see if there's any additional rotation possible, right? Then we're gonna go at each level and rotate around that point. So what do we expect to see if he has a problem rotating to this side, right? Okay, is that if we go to the right hand side and we motion palpate, it just stops there. If we go to the left hand side and we motion palpate, I get to the end and I apply a force, I can actually feel movement, right? So look at his head, you see his head moving, right? I'm just trying to exaggerate this, but if I do it to the left, it just stops there. There's no movement, right? And that's what you're basically going to feel on your hand that is in contact with the spine, right? The side that is fine, there'll be movement, right? The side that is restricted, there'll be no movement. Understand the difference?
So, the end range motion is training for the motion condition.
Yeah, right. Okay. End range of motion is not for the passive range of motion, right? Okay. Only difference between active and passive is active. The patient is doing it passive. You're assisting the patient, right? Okay. Because you want to check whether the muscle is involved or not. Get the idea, right? Okay. Motion palpation is for the joint, not for the muscle. All right. Yes. Yeah, which part? Okay, so that's what we were doing and answering some questions along the way, right? Okay, so number one, we covered the top. The neck part, same thing, just those three different directions, right? Flexion, extension, right? Number one, lateral flexion, right? Okay, and remember, always be on the same side. So if I'm going to do lateral flexion on the right hand side, I'm physically going to move to the right hand side, right? Okay, lateral flex over my contact point, and then when I reach the end of that motion, I'm physically going to, right, try to see if there's any more movement. We have a skeleton movement. There's one. So you guys should basically make use of these props over here, right? Okay. Can you guys see the skeleton from the back there? Okay. So the first action, you can join me over here, right? So the first part in the spine that we basically motion palpating, right? Okay. So what we want to do is we want to see how the skull, right, is moving in relation to C1, right? Okay. So our contact is basically putting the skull, right? So when we go into flexion, this part has to move, extension has to move here, right? So when you guys look at the skeleton, look at the joint, and see what's happening with the movement when you're moving that joint, because we can't see in his head because it's covered by his skin, right, and a layer of muscles. But when you actually look at the skeleton, it's a lot easier to see that movement. Get the idea? Okay, right? So that's the occiput in relation to C1, right? Then as we move down, now what you need to see is the joints over here, right? Okay. So if we're doing flexion and extension, if that's your contact point over there, as the neck moves forward, right, the spinous processes open up, right? As we move backwards, those spinous processes just come together, right? Similarly, when we're doing lateral flexion, right, and rotation, right? So use this skeleton to make sure you know what you're doing, okay, right? So you do it on his head. C1. That's flexion, extension. Okay, lateral flexion. lateral flexion and rotation. So just do the motion palpation for lateral flexion and rotation. Left first. Now you just resist that. Easy to see the restriction, right? Okay? So just turn around, face the other way. Come around. So just now you're normal. Just do the normal one again, right? So he's perfectly normal. He's gonna do the range of motion.